Thanks for watching AM Northwest this morning. Well, is your bust line busting out? Would you like to look a little perkier? You might benefit from a procedure that reduces the breast before adding back some fullness. Here to share the details, please welcome back from Gorin Plastic Surgery and Med Spa, Dr. Aaron Gorin. Good to see you.
Thanks, thank you.
All right, so what exactly, it's called a breast reduction augmentation?
Yeah, basically there's two things kind of combined at once, and it's not long-standing procedure. In other words, it's something that I sort of have thought about over the last 10 years and have sort of worked on more and more, and decided that when a woman comes in who has very large breasts, that they want to be smaller. If you just do a breast reduction, you can end up with more of a concavity at the upper part of the breast.
Okay.
And so there's, I think one of the best ways to preserve some fullness at the top is to place an implant at the same time. And that combination sounds kind of opposite.
Right. Reduction,
augmentation, one is going smaller, one's going bigger. So the implant that we use doesn't necessarily make the breast bigger, it just makes it a little fuller and perkier at the top.
And perkier is the idea.
Yeah.
Okay, so how does it work exactly?
Well, the breast reduction scars are the same incisions that a breast lift scars are used. And that generally goes with an incision around the areola and then down the breast. Sort of like a keyhole or sometimes like a little anchor on a boat. And that allows us to reshape the breast to bring things back up, and then the implant is placed behind the muscle to allow a little fullness at the top. We still can be as small as the patient wants, or as big as the patient wants, either way.
Well, because I know for women that have extra large breasts, they get backaches, they can't really jog, do anything really fun.
That's true, and this
activity-wise.
Right. So taking the weight off of the breast, of the chest, really does offload that weight. A lot of women ask, well, when we use an implant, is it going to pull down like natural large breasts do? And it really doesn't, because the muscle holds the implant in place, so it's like an internal bra.
Okay, and you are one of the few surgeons that does this, right?
Yeah, I mean, it's not that common of a performed procedure because there's some concerns about the overall healing and how things would take place, because the lift or the reduction is a tightening procedure, and the implant theoretically could be stretching things out. But when used a conservative implant, well, a smaller size, I found that the risks are no greater than just the straight breast reduction.
And you have a gentler way to put it in place, the implant.
In general, historically, placing implants was literally kind of ramming it in with your fingers, and it gets very aggressive, almost like a lot of pressure on the implant.
Right.
And that also is kind of causing some pain in the fingers over time. So this device called the Keller funnel, and I'll just display that.
There's
implant
the implant
here. Yep. Silicone implant. Keller funnel here. It looks basically like a pastry, like a icing applicator on a cake.
Yeah.
And so I'll have you do this, Helen. I'll just put this in here. So go ahead and grab that and try to apply that icing right onto the table. And you'll see how easy that is. If you just give it a good squeeze, it comes right out.
Wow.
There you go. So
that's kind of bizarre.
Absolutely. You could do that even like left-handed. I can do it non-dominant hand, no problem. It's the easiest thing. Even large implants, when someone's coming in going for that really huge look or whatever, this device is great. It's really saved my fingers from like long-standing arthritis moving forward.
When your patients go through this procedure, what have usually been the results for them, or their reaction? How do they feel?
I mean, generally patients love it. I always have to remind them that it's not an overnight transformation. It takes a good 2 to 3 months or so. And so when I get patients that come in, I always say there's a reason why we don't put photos of how patients look at 1 week, because it never looks really great at 1 week, but it usually looks really great at 3 months. So there's that aesthetic result about 3 months, but the overall recovery time takes about a week off of work, for example, from a desk job.
Okay, so not too bad at all.
And then generally about a few weeks before getting back into running and working out.
Okay, you want to tell folks if they'd like to find out more, all you have to do is contact Gorin Plastic Surgery, 503-692-7222. We'll put all the information on our website, and of course you offer free consultations as well.
Absolutely, anytime.
Thank you. Thank you, Dr. Gorin.